Hello, everybody. I hope this is working. Welcome to Injured Workers Community Legal Clinic online town hall. I'm just going to begin today by introducing sort of the background to what it is that we are about to do. Orlando and Catherine, I am turning on your cameras, so don't do anything embarrassing. My name is David. I work at Injured Workers Community Legal Clinic, and we obviously everybody is doing things a little bit differently right now, and we are, since the start of the COVID-19 physical distancing stuff, have been looking for ways to continue to connect with our community, to continue to engage injured workers and allies and activists. And so we are starting a sort of experimental town hall series with this. It's been a bit of a learning curve, so please be patient with us. I've had to learn a lot of things in order to make this happen. The most disturbing of which I learned just before we went live, that I am a much larger human being than the last time I had to wear summer clothes. What's going to happen today is we're going to hear from Orlando Buenastella and Catherine Furness about some background issues relating to the WSIB and the way that they're handling COVID-19 and some of the inadequacies of that approach, and some suggestions for how we might go about pushing for them to do better, which is the task that we would love for them to take on. This is called Crowdcast, this thing that you're on. We're trying it out. You might be watching on YouTube as well, but if you want to participate in the kind of chat and the questions, then you should come over to crowdcast.io /e/IWC-COVID. But you can watch on YouTube. But if you're here, then on the side of the screen, there is probably a chat box where you can talk amongst yourselves. The presenters will see that, but if you have a question, then down at the bottom, it says ask a question. If you hit that there, you can type your question in. We will see it, and also other participants will have an opportunity, if they were going to ask the same question or if they like yours, to kind of upvote your question. So if we do get a chance to answer questions, we'll probably address the most popular ones down in there. So without further ado, I think I am going to invite my friend and colleague, Orlando Buenastella, up to the stage here. Can you hear us, Orlando?
Yes, can you hear me?
I can. All right, let's trade places.
All right. Hi, everyone. Welcome to my kitchen. At the end of the show, I can share a Sicilian pesto recipe. And excuse us, we joke because we do not so joyful work often in terms of the people we see and we represent. I want to acknowledge the expertise that is around this conversation. We're not beginning the conversation, we're adding to it, and we're continuing to work together and to share and learn from each other. So, and there's been so much done already by organizations such as the OFL, ONIWIG, the legal clinics, which includes Hamilton Community Legal Services, IWC, IAVGO, and a lot of other organizations. So the spiel that I have today, I would entitle it File and Fight. In other words, apply, ring the bell to your own home, which is the WSIB, and get in the door. And if you need to push to get in the door, it's your own home. Okay, so those are the two things. So let me talk about ringing the bell, that is applying. First of all, let me talk about the disease itself, COVID-19. It's been described as a monster of a disease. And this description comes from the widow of the Oshawa worker. He was 48, who died working for a real Canadian superstore in Oshawa, as I said. And she said, talking to Global News, Keith was never sick and was not on any medication for anything. So that just tells us how it can affect up to and including death. Another article caught my attention, and it deals with the possible long-term consequences of catching this nasty disease. Let me just read one paragraph. According to one study, survivors of SARS suffered long infections, higher cholesterol levels, and were falling sick more frequently than others for as long as 12 years after the epidemic occurred in Asia, killing almost 800 people. So up to, and they haven't checked after 12 years, but up to 12 years of symptoms that can be continuous or can be recurring. So people could be having recurrences. So which is the system that's supposed to cover that? If you're a worker, it's the WSIB. And the system, the law is designed so that there is compensation in case of death, unfortunately. The spouse and the children, surviving spouse and children, are taken care of. And if you're not killed by the disease, there are various benefits that most of you are aware of. There's wage losses up to 65. Some exception can go past 65. There's return to work services, medical and vocational rehabilitation. So medicines are covered. And in case there's recurrences, there's waves, that is also recognized, as well as complications. They're called, in jargon, secondary conditions. But you can imagine those, psychological effects and other parts of the body not functioning. And we already know from the literature that this is happening. So it's very important to ring the bell. I looked at the numbers. There's, and I could be corrected because the numbers vary a bit, but 26,000 cases in Ontario. In terms of applications for WSIB, 3,260 and odd. So the numbers, again, could be changing here and there, but a small minority of the cases are going to the WSIB. And we have to think why. There's many reasons. Many workers are not covered. So if they rang, they wouldn't go in automatically. And in fact, the taxi drivers that were involved in the airport, limousines, some of them are died. They're not covered. They're considered independent operators. And I think this issue, once there is that involved and they're not covered, the issue of universal coverage is going to be coming to the fore very strongly. There's many other reasons. Many people don't know that the WSIB exists. Those that know go, oh my God, I'd like to avoid them. Oh, I'm gonna go through hell, right? So that's out in the community. And people might be tempted to go to an easier route, SERB, EI, and other routes. And that's fine. But it would be a mistake to only go that route. If it's work-related, they should ring the bell at the WSIB, even though they have to put food on the table and go and get some shorter-term benefits, because those short-term benefits will not be applicable 12 years and past. That won't happen. So how the WSIB has not really been promoting itself about this. April 28 came. That would have been a good opportunity to say, by the way, COVID-19, huge issue for workers. We are here to help. Come to us. I didn't hear that message. I look at the website and I see that there's a financial relief package. You look at it, it's for employers. $1.9 billion saved to employers who are not going to be paying, or rather, their premiums are being deferred. And we don't know if the deferral to August is going to continue or not. So and this has got implications in terms of the way the WSIB will adjudicate claims. We know their thinking. They've been spending the last 20 to 25 years trying to eliminate the unfunded liability. Now there's no money coming in for several months. What is their thinking? Gotta be careful, gotta be careful, gotta be careful. So that creates quite a dynamic from my experience anyway. All right. There's a frequently asked questions section on the website. I'm sure you've seen or go to it. One of the questions that the WSIB asks is, I think I contracted COVID-19 at work. should I file a claim? What should be the answer to that one? They don't even have to commit to saying yes. We will rule in your favor. But in terms of should I apply, the answer should be yes. I could not find the yes answer. I see you may file a claim. The answer that they give is go to the employer, tell them there's an accident that you have contracted COVID-19. But when it comes to you, it says you may, as a worker, file. And I think they should be signaling a different approach. They should be signaling that they should have a hotline. They should have a way of saying, come and ring the bell. We want to hear from you, rather than, go to the boss. And then they tell the worker, well, if the boss doesn't report it, it's fraud. So complain to us, to the fraud line. And I checked, go and see. The fraud line says, well, we're not sure that we can keep this confidential. And eventually we'll have to release the information to the employer. So you can already see the dynamic. Somebody in precarious employment says, do I want to report my boss as a fraud? So the weak person is supposed to police the bully. So there needs to be a turnaround. The agency that is supposed to protect workers needs to step in and avoid there's any bullying, rather than leaving it to the poor, defenseless worker. So I call for a much broader approach by the Wsib in terms of letting people know that it's there. The Wsib should be stepping forward and saying, we are here to help, like other institutions have done. We are here to help, rather than giving signals that it's going to be very difficult if you come to us. There's one important detail that I want to leave with you, because now I'm going to talk about the adjudication approach. Okay, once you ring the bell, then the door may open, it may be shut back. So that's the issue of being accepted or not. But in the website, again, answering the question, should I file a claim? One example is given by them as to a claim that might be accepted. And the example is this: the nature of people's work may put them at a greater risk of contracting the virus. For example, those treating someone with COVID-19. Well, I'm sure that they would say, this is just an example, I don't focus on this. Well, yes, let's focus on this, because the example given presumes that the spread of the disease only happens when there's symptomatic people, when people already have it and they're sick of it, they're sick from it. Whereas we now know this could have been the information months ago, but we have heard the news. We've heard the news today. The problem with the disease is that it's spread by people who have no symptoms at all. So to focus on people who are treating sick people as the main vehicle for compensation is really narrow and wrong. And by the way, I think there's people who have treated patients who are not necessarily getting compensation. Okay, the last thing I want to talk about is the Adjudicative Approach document. It's on the website, and this is what they're going to be using in terms of deciding whether somebody who's sick from the disease says it's coming from work. So this is how they're going to look at it. The gracious thing that I have to say about the document is that it's not yet policy. And those that are practitioners of workers' comp know that when something is a policy, it becomes very much entrenched. It's written in stone, and it's also binding the tribunal. So that's very serious. So luckily, it's not yet a policy. And the other gracious thing that I have to say is that it says the document may be updated when appropriate as more information on COVID-19 becomes available. So that is good. The rest, not so good. I see in their guideline that there's a preoccupation with the source of COVID-19. Where did it come from in the workplace? Is somebody sick from it? And that's, again, old thinking. The disease spreads by droplets, and it could have been anybody. It could have been a coworker who's perfectly healthy. It could have been a client, customer, whoever you're in contact with at work, could be dropping a droplet on a handle anywhere. So focusing on discovering the source leads nowhere. It leads into denial. It leads into confusion. For example, let me just read directly. They ask, has a contact source to COVID-19 within the workplace been identified? Headache. Was there an opportunity for transmission of COVID-19 in the workplace via compatible route of transmission for the infectious substance? Headache. How do you find that? You're preoccupied with the source rather than the effect, and you're not preoccupied with the simple question: did you contract the disease? Were you working? And did your work put you in contact with coworkers or other people? Which would be a very simple way to begin. And at the end, there's something that disturbs me. And there's a notion there that, in my view, can potentially introduce the idea of fault into adjudication. We know that the workers' compensation system is based on no fault. If it happened at work, if it happened as a result of work, we're not going to start to say, oh, wait a second, you could have done better. It's your fault. You were stupid. You didn't follow every rule. That's the deal. You can't sue the employer. On the other hand, will compensate you fairly without finding fault. Well, let me read this. This is what the document says. You as an adjudicator should be looking at any information you can that may be bearing on decision making, such as information about the work environment, work processes, job tasks, and the use of personal protective equipment. Well, wait a second, what does that mean? Is the employer going to say, well, I produced the personal protective equipment, I had soap, I had this, I had that, cleaning agents here and there, and you come to us and you're now saying that you should be compensated as work-related. We tried, we did the best, it's your fault. And there may be sympathy to that argument because it's sneaking in. The website has a, to some extent, useful guide for employers, and it says, getting your workplace ready. And there's several pages about making sure that the health and safety, that there's cleanliness, that they sanitize personal equipment, this and that. So that is good, right? So we like that. I like that. But that does not mean that there will not, despite the best intention, despite the best cleanliness, right? It does not mean that there's not going to be COVID-19 cases, because that disease that enters in whatever different ways. So yes, thank you, follow this, it's helpful, but it doesn't mean that this will be an absolute protection. Why are we trying so hard to get the vaccine otherwise? Right, come on. So I could look at the numbers. The numbers of approved cases are not good. So far, 1 out of 3 approximately of the workers who are applying are getting denied. And in fact, the majority of all cases are not yet adjudicated. They're waiting. And you can see that if you're working at the Wsib under these orders, you're going, oh, how do I adjudicate this? Where's the source? Where is this? Where is that? Where is that? The other thing, right? So just the stuff that we don't need. Workers need protection. Workers need fast, I help you, right? So, and we need a presumption. So lots of people, lots of organizations have argued for a presumption. So if it happened at work, if you're in contact with other people, if you're in contact with other coworkers, sometimes you could be working at home. And, working at home is not totally isolating. In some working conditions, there's a lot of people working in the house, living in the house, especially if you're not well off. So there should be a presumption. Happen at work, were you working, yes or no? Do you have a condition such as COVID-19? There should be a presumption that it's work-related. So the ultimate, so I want to stop there. Otherwise, you get me going, and I don't stop no more. Anyways, thanks so much.
Thank you, Orlando. We're going to go to Catherine Furness in just a second, but I had forgotten to mention that the format of today, there will be another presentation from Catherine, and then we're going to go to some quick respondents, just to get a little bit of insight from an injured worker from the Peel Injured Workers Group, Catherine Fennick, and then to Andrew Bome with the Hamilton Legal Clinic and Donnie Wig. But right now I'm going to go to Catherine. Hello, Catherine. Oh. Hold on. I don't have your microphone on now. Uh-oh. I cannot hear you. I'm going to turn your microphone off and on again and see if that helps. Oh, waiting for Catherine to reconnect. Let's look at me in the meantime. Hi, everyone. Yeah, Angela, we're going to get a little bit into some of the things that workers can do in the process of applying for COVID-19 claims, as well as some of the things that workers who are already injured, who have not, who don't have COVID-19, but as well as the ways that they could go about asking for benefits from the WSIB. Okay, so let's bring Catherine back in and see what's happening. How about now? Are you talking, Catherine? Oh, no. No. How about, Catherine, this is a little unorthodox, but why don't I telephone you and put you on speakerphone, and then hopefully that will provide us with some.
I can hear
Catherine.
You guys.
Hey, there you are. Okay.
Yay!
All right.
Okay.
Thank you, folks. Yeah, we appreciate the patience. As we say, we're all brand new at this, but thanks so much for sticking with us.
It's our first time doing this, so thanks everybody. Sorry for that slight delay. So I'm Catherine, and I work at IWC with David and Orlando. And so what I'm going to focus on today is a bit more about the issues facing current injured workers, because Orlando was talking about the COVID policy, the WSIB's COVID policy, mostly as it relates to kind of people who want to claim it as injured workers as a result of COVID. So for current injured workers, what I want to kind of mention a few different things. The first is actually I want to acknowledge that Angelo, one of our participants, has made a really excellent comment that I want to just bring to everyone's attention. And he said that I hope to add that COVID-19 can also be accepted on an aggravation of a pre-existing condition, as they do have a policy that exists. So basically, if an injured worker that has an accepted WSIB claim, a permanent impairment, if they contract COVID-19, not at workplace, just in general, and having COVID-19 then impacts their underlying workplace condition, then according to WSIB policy, they should be able to make a claim related to an aggravation basis. So that's a really good point, which injured workers should keep in mind if they contract COVID-19, whether it impacts their underlying condition, that their underlying workplace disability. Another issue for current injured workers is about deeming. So deeming, for just as a reminder to people or as an explanation, deeming is when the WSIB pretends that a worker has a job that they do not in fact have, that an injured worker has a job they don't have. So the legislation says that these pretend jobs must be suitable and available. But economic data tells us that unemployment numbers have grown significantly, and it affects available jobs, obviously. So we know from research that many injured workers face health challenges that could compromise their immune systems, meaning that seeking work in the present pandemic is not suitable. So the Workers' Comp is a Right campaign has been trying to do a little bit of advocacy around deeming in the context of COVID-19 to say that the WSIB should reinstate full loss of earnings for workers who have been deemed at least until the end of the pandemic and the subsequent economic recovery, because as I just alluded to, the employment numbers in Ontario in the wake of this crisis are totally dismal. And if there are no real jobs, then there can't be any phantom fake jobs either. So the Ontario Network of Injured Worker Groups and through the Workers' Comp is a Right campaign has been trying to advocate around this issue of deeming. Even before the pandemic, it was a big issue. And now during the pandemic, it is even more of an issue. So we certainly encourage injured workers who have been deemed to ask the WSIB to reconsider instituting their loss of earnings
Hey,
to say
Catherine.
that.
So I'm just going to jump in just to let you know. Maybe we didn't. I'm actually going to share the sample letter that people can write to their case managers, to the WSIB, to ask to be undeemed towards the end of the presentation.
Perfect. So as David mentioned, we do have a sample letter which was created so that people who have been deemed, injured workers who have been deemed, can write directly to their case manager. This is a systemic issue, but the WSIB doesn't seem to want to address it on a systemic level despite several organizations' requests. So our kind of alternative strategy we're suggesting is that individual injured workers make that request and see where we get. And so similarly, I want to move to the last topic that I want to touch on about current injured workers, and that is about extra isolation costs that injured workers face because of COVID-19. And that basically our perspective, and the perspective that we've heard from injured worker groups, is that there are extra costs that injured workers will incur while practicing physical distancing and social distancing to stay safe during COVID-19, or to try the best they can. So these things can be stuff like taking a taxi or an alternative transportation to appointments, or to acquire medications, like to go to the pharmacy. So where an injured worker might have previously taken public transit to get their medications or to go to a medical appointment, now taking public transit is more risky. So a taxi might be more appropriate. And so that's an added cost. Delivery costs for groceries is another added cost, and any other necessities. So that those added costs, and even the delivery costs for groceries, I mean, the cost of groceries in general when you're making an online order are generally a bit more expensive, and you can't shop around for deals. So basically groceries is another thing that's more expensive. Any personal protective equipment that injured workers want to buy, like face masks or gloves. Another topic is home health equipment that workers may need to mitigate the problems by canceled physio or massage. So for example, right now, a lot of injured workers can't go to healthcare appointments, and so that might aggravate their conditions. And so if they need some sort of home equipment to be able to stretch or strengthen or self-massage, things like that, the WSIB, we think, should proactively inform injured workers and give them access to these funds. And so when IWC specifically wrote to Tom Teahan, the president and CEO of the WSIB, about this, and so did Oniwig. And so when we got a response from Mr. Teahan, what he said basically was that they suggest that injured workers follow the guidance of public health authorities. And so in situations where it's essential that they get medical treatment or pick up a prescription related to a work-related injury or disease, but they have safety concerns about the means of travel, they should contact their case manager to discuss an alternative means of travel. So I guess he made a tiny bit of an opening. He opened up the door for injured workers to make a request, and it's so that, I mean, he didn't do it again on a systemic level, similar to the deeming issue where we want injured workers. We think that the WSIB should address this on a systemic level, but they've said, well, we're going to leave it up to individual injured workers to ask for it. They've done the same with these extra expenses. They think that, you know, individual injured workers can or should make a request to the WSIB to ask for any additional expenses specifically. This is totally contrary to what other branches of government and benefit programs and institutions have been trying to do in this pandemic to support individuals in society, like all of us, to try to get through it. So as an example, people who are on OW or ODSP, they are getting an additional benefit. I think OW and ODSP is $100 monthly for 3 months. And people who are over 65 on old age security, they are also getting an additional $300. And if you are also a low-income senior, you get an extra $200 for a total of $500. And that extra money, which OW, ODSP, and old age security are providing, are in recognition of these things that I've been talking about. They've been to acknowledge that there are extra costs to people in order to be able to physically distance, particularly for individuals who are part of these more at-risk groups like seniors and people with disabilities and on low incomes. So from our perspective, injured workers fit these categories, and the WSIB, it would make sense for them to do the same thing. When we asked, basically, and when Oniwig asked, the WSIB has said, as I said, that there should be, you know, individuals can go and ask. So what we've done today, so what I want to do next is I want to walk you guys through how people can make that individual claim to the WSIB. And I'm going to suggest doing it in a way that raises that systemic concern and ask the WSIB to do it, not because I have this bill and this bill, but to say, I think you should give me $300 to acknowledge all of these expenses. So if David, you wouldn't mind putting up my the PowerPoint or slideshow so that I can walk people through the steps to making this type of claim, that would be helpful.
I think it's there.
So here is what we have for step. Yeah, got it. Steps for claiming pandemic pay from the WSIB. So the first step is just to prepare a letter to the WSIB. We've tried to do that for you in creating a form letter. If you're not comfortable using our form letter, then you can either modify it or write completely your own, but we wanted to make it as easy as possible for people. So basically, David is also going to link at the end to the form letter that we've created, and we're going to post it after this on Injured Workers Online. And that letter is going to tell the WSIB that the pandemic is increasing your costs. So this is an individual injured worker writing this to the WSIB and saying, my costs have increased because of the pandemic. For example, I want the WSIB to send me $300 like other government programs are doing, like OAS and OW and ODSP. So you can go and get that form letter or make your own. You want to make sure you include your name, address, and WSIB claim number. And then save that document to your desktop. I know some of this is, I'm going to go through this very specific steps because I know that some people have challenge with technology. Uh-oh. Or is David gone? Can someone write in the chat box if they can hear me? Perfect.
Yes, sorry, Catherine. We can hear you. I just turned off your camera because it was stuttering a little bit, so I just wanted to let people just hear you.
No problem. I also can't see the PowerPoint.
Oh,
no problem.
There.
As long as because I can't see the PowerPoint, so as long as other people can.
Yeah.
Perfect. So I know that a bit of this is a little bit, it's very specific, but I just wanted to do this so that people who have never made a claim to the WSIB before online, or nobody's uploaded something to the WSIB before, then I'm just going to walk you through that quickly. And this slide presentation will also be made available at the end so that people can see those steps and check them out. So because I can't see the slide presentation, I'm just going to pull up my own here. Okay, so the first step, David, I hope because I can't see it, you're going to follow along and move along to the screenshots. So the first step is going to the WSIB website, which I've put a little red box around, wsib.ca/en/upload. So that's where you go to upload a document to the WSIB website, and it has to be specific to your claim file. So the only people who can do this are injured workers who have a claim file number. It's not for people who are advocates who want to write a letter to the WSIB about this. This is for injured workers who have a claim file number. So you want to go to that page and go to that upload word that I've circled and click on that. And then the next page that's going to pop up is one where you actually have to put in your last name, your claim number, and your date of birth, those 3 red lines that I've showed you, and then click next. And then the next page, you have to go to this attach button. So you click attach, and then a screen is a little box is going to pop up where you have to choose the document that you would like to attach. And so that's the reason why I suggested you save this letter document to your desktop, because when this gray box pops up, you'll see that I put in a little red square around desktop. So that's an easy way. You don't have to go searching through folders to be like, ooh, how do I find my file? You can just click that little desktop word there, and then everything that's saved on your desktop will show up along those lines. And so you can find the letter, click on it, click open, and then it should then ask you a couple of questions there. It'll say the next page, it has tell us about your documents, and you just have to click. I made a circle around no there. Did you get this document from the website? No, because this is a letter that you've created yourself. It's not a WSIB form. And then it'll ask you who completed the document, and you would put person with an injury. Then you click next. That your claim number is correct and the file name that you've chosen is correct and the information you put. And then if you would like an email confirmation, then you can put your email address there in the box, and then you'll get a confirmation email saying that they've received it. And then you have to click this declaration box that says that you're using this WSIB upload tool and you understand that it's got what you're sending is truthful and accurate. And then you click submit. And then you get a confirmation page, and hopefully that is that. So as I said, I apologize for the people who've already used this upload tool and who don't have technological challenges with that. I just thought it was a good idea to go through it for anybody who hasn't, so that we can let down any barriers around people who are a little overwhelmed by technology and who have never done this before. So again, David's going to be sharing that form letter. And you're welcome to use it and to make sure you add in your claim number and name. You can add or take away any examples that you feel you want to, and then you can upload it to the website. What I think will happen after, the next thing I just want to talk about is what I think will happen after. So after you send this generic letter saying, please give me $300 because I'm an injured worker and I will have extra costs, I imagine that someone from the WSIB is going to contact you and say, what costs are you talking about? Can you send me receipts? And I mean, I think that what our approach is that I think that we shouldn't, as I mentioned, I think that we shouldn't be nitpicky, and I've addressed that in the letter, the sample letter. Other government institutions like OAS and OWODSP are providing lump sums without requiring receipts. And so not only does requiring receipts increase unnecessary bureaucracy, but there's also many costs that are hidden, like ordering groceries online, like I said, is often more expensive, and that's not something that you'd have a receipt for. So I would just say you can, if you have any receipts, then you're welcome to send them. But I think that you can also repeat what's in that form letter around, I think that you should just send a generic lump sum like all other institutions have. And And we're suggesting that you ask for a response in writing so that you can actually appeal the decision and we can use it as an advocacy piece. And IWC would love to know the outcome of your request. So please do contact us. Our phone number, if you can find it on Injured Workers Online, but it's 416-461-2411. We'd love for you to leave us a message and let us know what happened, and then we can connect over it and see whether this is getting any traction and what kind of responses the WSIB is giving. So I think that is that's what I wanted to say. I wanted to encourage individual injured workers to try out this strategy. We can't promise that it's going to be successful, but we thought that it was a starting point for trying to get the issue noticed and for addressing it on an individual level, because that's what Tom Tian, the president of the WSIB, suggested injured workers do.
Awesome. Thank you, Catherine. I really appreciate that. Again, if folks have questions about what Catherine has talked about here, then they can, of course, type it in down at the bottom of the screen where it says "Ask a Question." There should be, for those watching on Crowdcast, there should be a button right now below my face that says "Sample Letter" as a Word doc. If you click on that, it'll take you to a Google Drive where you can download it. I will try to share the link in the chat as well, though I was having some trouble with that. Right, what we're going to do right now is invite one of our first respondent up today, who is an injured worker, who is going to talk somewhat about, I believe, injured worker and other folks' experiences with additional costs that are being incurred by folks who are struggling with injury during COVID. Catherine, can you hear us?
Hello, I can hear you. Can you hear me?
Yeah, we can. Wonderful. Nice to see you.
Yes, good to see you. So first of all, I'm from Peel Region, and our region has been hard hit by COVID deaths from workers. As Orlando mentioned, there was the 10 taxi drivers, limousine drivers from the airport. There was a worker at Brampton Civic Hospital, a cleaner, and the media made a point of coming out and saying, well, it wasn't work-related when they could find no link to where he would have got it in the community. He was a cleaner in a hospital. And then there was a worker at Maple Lodge Farms who died where there's an outbreak in that workplace, as well as there was a PSW who died. So my last count was 13 workers in Peel Region have died of COVID. And none of those families should have to fight to get compensation. We've recently seen the case of Leonard Rodriguez. Many of you may have seen this, that the family, Leonard was a PSW who died working in a home where there was an outbreak, and his family has now set up a GoFundMe. And again, nobody should have to do that, and that's where we need presumptive legislation. I know I'm supposed to talk about the costs. For all of you injured workers, anybody who lives on a fixed budget, a very tight budget as we do, that COVID-19 has been very expensive. You go to the grocery store, things are more expensive. You can't shop around like you used to. Sometimes you make choices based on your injury. I had a plumbing issue on the long weekend, and I didn't go to the store that had the cheapest plumbing parts. I went to the store where there was going to be the shortest lineup because my back just couldn't handle standing in a line. I ended up having to go to multiple stores, and by the time I got the parts I needed, I was in too much pain to actually do the repair. So getting out and getting groceries or getting anything, when you have to line up to get into the store, you have to line up in the store, can be really difficult. Catherine mentioned that ordering online is expensive. It is expensive. I've seen my parents have been doing that because they can't go out, and I'm just shocked at how much they're paying for things, and plus the additional surcharges for delivery and whatever. And you place your order and you get it, whenever, right? You don't know when you're going to get it. I had somebody call me today talking about prescriptions. So for the drugs that WSIB doesn't cover, now you can only get 30 days prescription or on your refill. You can't get your 90-day refill. That means you're going to pay that dispensing fee 3 times. There's so many costs that Now stores aren't putting out flyers. You can't price match. There aren't the sales. I mean, with the run on toilet paper, you run out of toilet paper. It's really expensive if you buy it at regular price. And for those of us who are living on so little, it's just so expensive. So I encourage all of you to apply to WSIB and ask them to cover some of these added costs that we are facing. As people with disabilities, we are vulnerable people. And just leaving the house can be really scary. I mean, I know I suffer from anxiety, and I'm not comfortable going out. In the last few weeks, I found things have actually gotten much worse because people aren't, I guess, I don't know if they're tired of social distancing or what's going on, but it's getting more difficult to get out. And Catherine mentioned that ODSP are giving people, actually it's $400 they're getting. It's $100 split over 4 months. In BC, the government's actually giving $300 for 3 months, so they're getting $900. And you don't have to justify it in it. And the reason OW and ODSP said they're giving it to cover for cleaning, extra cleaning supplies that you need. Now, when you bring your groceries home, you have to clean them, or, to be able to sanitize, gloves, whether it's masks. There's all these added expenses right now. It's just really expensive for us to live. And I know a number of us have been really frustrated when we see the CERB that is paying people $2,000 a month. And, if you're working $2,000 a month is not a lot of money. If you're an injured worker who's been deemed or forced onto social assistance, $2,000 is a lot of money. So if the federal government is telling us that people need a minimum $2,000 to get by, then hey, why are some of us living on so little? And many injured workers who are deemed to have jobs that don't exist right now are living on a lot less than they would even get on social assistance. So, times like this really affect the most vulnerable among us more significantly, and that's what this is doing. And this is a really difficult time for injured workers. And I think WSIB needs to step up and take care of injured workers, because nobody else is going to do it. We don't fall under any other program that's going to help us. It's the WSIB that needs to take responsibility. We got injured at work. They need to take care of us. So I encourage everybody to fight for that.
Awesome. Thank you so much, Catherine. I really appreciate your thoughts there and your time, and that you hung the workers' comp as a right banner behind you. Just for the moment, I appreciate it. But we will talk to you again soon.
Okay, thanks.
All right. I am now going to, theoretically, as always, invite Andrew Bome from Hamilton. Let's see if our luck continues. Aha, Andrew.
Can you hear me?
I can hear you. Can you hear me?
Absolutely.
Wonderful. Okay, I'm going to make you the big face. And I mean, I didn't give you too much of an introduction, so feel free to say a little more about yourself, and then really anything you want in response to what you've heard today.
Yeah, I'm a staff lawyer at Hamilton Community Legal Clinic, and I go to look at the camera. And I also do legal work for the Ontario Network of Injured Workers Groups. And what I want to talk about is what the WSIB is doing for people who have been quarantined but have not been sick. And the answer is nothing. They have decided that in order to get benefits for COVID-19, you must have symptoms. So if you're in a workplace and you've had a coworker that was, that had symptoms of COVID-19 and you were sent home for a 2-week quarantine, tough. You don't get workers' comp unless you subsequently get sick from COVID-19. That is wrong. That is terrible. That is awful. And I also believe that is contrary to the Act. Now, why is it wrong? We went through this with SARS back in 2002, and workers, we weren't taking all the precautions that were necessary because of reasons. And the Campbell report talked about something called the Precautionary Principle. And what the Campbell report said is that when it comes to reducing the risk to a worker, to their safety, you don't wait for something to be scientifically certain that before you take the precaution. And this is what the recommendation was, that in any future infectious disease crisis, the precautionary principle guide the development, implementation, and monitoring of procedures, guidelines, processes, and systems for the early detection and treatment of possible cases. What the WSIB is doing is just flagrantly ignoring that recommendation. Now, why that's important is that if you're a worker, living on paycheck to paycheck, and a lot of workers, that's the reality of their lives. Most workers are a couple of paychecks away from missing a rent payment, missing a mortgage payment, not being able to buy groceries. You're going to be less likely to report anything that would cause you to be quarantined for 2 weeks if that means you're not getting anything. So that increases the risk, not only to the worker themselves, but to that worker's co-workers. And so from just a policy perspective and a principle perspective, workers' comp is behaving quite terribly, saying, we're not giving you anything if you got sent home and you lose your paycheck, unless you subsequently go on and get sick. And we know that not everyone who gets quarantined goes on and gets sick, right? Most people don't get sick. And the numbers so far, we actually know how many people have been exposed and potentially quarantined, because what the WSIB has said is that if you're exposed to COVID-19 but you don't become sick, you can file what's known as an incident exposure report. And workers' comp actually has been publishing the statistics, and I've been keeping track of them every week. And the last statistics came out on May 22nd. I just looked that up this morning, and so far, between claims that were made for benefits and exposure incident reports, there've been roughly 6,100 incidents. Just over 2,000 of them have been exposure incident reports. So what that means is that roughly a third of all work-related COVID-19 incidents did not involve people getting sick. They just involved people who were exposed, and they were potentially facing 14 days of quarantine. So it's not a small number. It's actually a fairly large number. Like I said, roughly 1 in 3. I believe that the law says that if you cannot work because you are on quarantine because of exposure to COVID-19, that you're entitled to benefits, right? And I come at it from what the legislation says. You get benefits for having an impairment because of an injury, right? And the definition of impairment, it says in the Act, impairment means a physical or functional abnormality or loss, including disfigurement, which results from an injury and any psychological damage arising from the abnormality or loss. That is a really, really confusing sentence. And It took me about an hour to figure out what that actually meant. And what I came up with is that you have an impairment in one of 5 circumstances. You have a physical loss, you have a physical abnormality, you have a functional loss, you have a functional abnormality, or you have any psychological damages that arise out of the first 4 things. What's a functional loss? Well, I think that if you can't work because you've been exposed to COVID-19, you've suffered a functional loss regardless of whether you have symptoms, right? Because the whole point of workers' compensation isn't that you get compensation because you're sick. The whole point of workers' compensation is that you lose wages because you were sick, right? And with COVID-19, if you can't go to work because you've been exposed to something, you can't go to work because of something that happened at work. You have a functional loss, and you should get money for that. And there's some support in the case law. There's a Wsib, don't know the number, because I couldn't find it this morning. But in that case, the tribunal granted a worker loss of earnings benefits when they were told to stay home because to stop the spread of a potential infection. So there's already, it's obviously not a COVID-19 case, because by the time you get to the Wsib, you're talking like 4 or 5 years after the fact. But in a situation where a worker was sent home to stop the spread of a potential infection, and that was a work-related thing, that worker was given loss of earnings benefits. So between my reading of the Act and this one Wsib, I believe that workers' comp is wrong when they say that you're only entitled to benefits if you get sick. I like the idea of getting extra costs due to COVID-19. My only concern is that workers, workers comes very different from ODSP and EI and this and EI and things like that. A lot of those other benefit paying schemes, when it comes to how much money does a person get, so how much money does a person get on ODSP, that's not in the legislation, that's in the regulations. And what that means from a practical point of view is if you want to change the amount that somebody gets, it just requires a change in the regulation, and formally that's just done by a cabinet decision. Workers' compensation is different. There are no regulations that talk about benefits. All of the benefits that an injured worker receives is set out in the legislation. That means that you're bound by the legislation, and moreover, the legislation can't change without going through the legislature, going through 3 readings, going through royal assent. That's a little more difficult. That's a little more time consuming. And given that we're talking about Tories here, probably not something that is going to happen. And when it comes to why should an injured worker get these benefits, the only section that kind of fits is the healthcare section. But unfortunately with the healthcare, I forget the section of the Act, but healthcare means professional services provided by a healthcare practitioner, services provided by or at hospitals and health facilities, drugs, the services of an attendant, modifications to a person's home and vehicle, and other measures to facilitate independent living as in the board's opinion are appropriate, assistive devices and prostheses, extraordinary transportation costs to obtain health care, such measures as to improve the quality of life of severely impaired workers as in the board's opinion are appropriate. The only section there that seems to have any wiggle room that would allow the board to pay some lump sum is such measures to improve the quality of life, but that can only be paid to severely impaired workers. And a severely impaired worker is someone who has a 60% non-economic loss award or higher. I don't see anything else there that can justify just saying, give me $300 a month. I'm not saying don't do it. Just because I don't see it doesn't mean someone else can't see it, because in my career, I've actually known some very good advocates to do things that I thought, you're never going to win on that. And well, in one notorious case, the Supreme Court agreed with that guy, not me. Right. So, just because I don't see it doesn't mean that somebody else won't see it. But I do agree with what Catherine said, and what Catherine said, the two Catherines, is that an injured worker is going to have extra costs. Many of those costs are going to be related to healthcare costs. So you're talking things like taking public transit to go to the doctor is difficult. You can't get Uber. I'm not sure what the taxis. I don't even know if you can take a taxi now. In a lot of cases, you're having your healthcare being provided virtually. People on a budget don't have the kind of like unlimited data that people like me have. So their data costs go up. Those should all be paid for, right? Those should all be paid for. And if you have, I do think you have to, when you go and ask for the money, you do have to have some kind of breakdown of what that money was used for, right? I do agree with Catherine Furness that the notion of, you have to have a receipt for it all is just an added bureaucratic impediment in denying claims. And my crack about the WSIB taking a long time to make those decisions, I can see in a lot of cases the WSIB just simply refusing, in the first cases that come through, the WSIB just refusing to make any decisions until you provide, I don't know, notarized receipts. But that's about all I have to say. Thank you for letting me talk.
Awesome, thank you, Andrew. I really appreciate your thoughts. Those are super insights. And I think it's all three of us. One of the thoughts about this is not only that we certainly hope the WSIB would provide those 300, that amount of money. Guys, I'm gonna turn your microphones back on, so if you're listening to any crazy rock and roll music, now's the time to turn it down. But that I think it is a good sort of systemic advocacy approach to have them have to make decisions on things like this that really highlight how absurd the actual functions of their policy are. And that's one of the things that Catherine was talking about earlier on with deeming. We have always felt that deeming is absurd. I think one of the challenges has always been is that deeming is so absurd that when you explain it, people have trouble understanding it because it is such a ridiculous concept. But obviously, COVID-19 didn't create deeming, but it really highlights how much of a challenge how absurd it is at the time. The fact that the WSIB is pretending that injured workers have jobs has always been ridiculous. It is especially ridiculous when there are no jobs available to be had whatsoever, or the jobs that do exist are particularly dangerous for people who have compromised immune systems or injuries or other sorts of things. So, as Catherine said, one of the things that IWC did was create a draft letter for workers to send into the WSIB in order to ask for their deeming to be suspended at least until the end of the pandemic, or until the economy has recovered from the pandemic. And this letter cites job loss numbers and some academic research about the suppressed immune systems of injured workers. I'm just going to, now I'm having trouble sharing the links to all of this stuff. So what I'm going to do is show you guys answer this, which is my screen. So at this link there, tinyurl.com/IWC-COVID, there is 3 documents there. One is the presentation that Catherine gave earlier on that walked you through making this $300 request. One is the sample letter that she wrote, and one is the sample deeming reversal letter. I also put, there's always information about contemporary workers' comp issues, up-to-the-minute information at injuredworkersonline.org. And if you're an injured worker who does have questions about these things, IWC's offices are closed, but our phone lines are open. Our phone lines, we're taking calls now. You can call and leave a message, and you'll get an appointment pretty quick to speak with a legal worker on your claim specifically. So that's what I wanted to talk about there. There are a couple of questions in the inboxes, in our question box that I think we could answer. Catherine, is your microphone working?
You tell me.
Hey, look at us. So, the first question actually is for you, Catherine, from Sarah Neath. Catherine, thank you for speaking about injured workers' inability to get treatment. What are your thoughts about those who have no other options besides hands-on therapy, massage, tissue release, physio, who are deteriorating, and it is making working more problematic? It would be difficult to simply ask for $300, but they don't have receipts or specific treatments at this point. So
right.
Yeah,
so I mean, I don't have a specific answer that'll give you 100% success. This is the way you do it, because we're kind of in unprecedented times, obviously. But I guess some thoughts that I have about that are, first of all, whether I appreciate that massage and tissue release and physio are in person are ideal, but one suggestion would be to have a video or phone meeting with your physio massage therapist to ask whether there's any way that they could, for example, your physio could guide you through exercises over the phone or over video. The massage therapist could maybe recommend some sort of massage like stick or exercise with some sort of equipment that might facilitate it. So I would recommend basically trying to make a video or phone appointment with your massage physiotherapist to get some advice and see what they can offer. I have actually heard about a case where an injured worker was able to insist on getting a tablet because they didn't have a tablet to be able to do online physio. And so their physiotherapist was willing to give them physio virtually, but they didn't have the capability. They didn't have a tablet. So the WSIB actually agreed in this case to do a tablet rental, which ridiculously will cost more than actually buying the tablet itself. But the WSIB just, out of principle, I guess, decided that they wouldn't just pay for the tablet, which again would have been cheaper than renting it. So they rented it. But all that to say, my suggestion is to talk to physiotherapists and your massage therapist to see if there's any equipment or sessions that you could do virtually, and then use that as a cost and as a way. And if they do physio sessions there like virtually, that will also cost something. So those are my initial thoughts on that. And if there's a specific injured worker who has an issue and they want to get some advice, then they're welcome to call IWC and then book an intake appointment.
Awesome. Thank you, Catherine. And Orlando, we'll come back to you for sort of general thoughts before we wrap up, but do you have anything that you want to add just to that specific question?
Are you able to reconnect with Catherine? She may have lived experience around this one.
Yeah, sure. Let me see what I can do, Catherine. If you are still out there, prepare for an invitation into our stage.
The other question that's up there while we're waiting is if they deny the $300 request, can it be appealed?
Yeah, we will come to that one. To that one.
Okay.
Catherine, Catherine Fennick. So you're up here. Do you have any thoughts about pursuing therapy without touching anyone?
Well, I suffer from repetitive strain injuries, myofascial pain syndrome. So being able to release my muscles on my own is a godsend, because even if therapy was available, you can't run to the therapist, every single day. I think that there are various tools, like there's a Theragun I've never tried. It's a percussive massage tool. There's a Theracane. There's various massage devices out there, massage chairs. I think that's what people should be looking for, to get that kind of those things in their homes, requesting WSIB to pay for it because they can't get to therapy. And I think, it's always useful to have access to that sort of equipment anyways, because you can't keep running to the massage therapist,
For sure.
every time something happens, which, with us, it's just functioning and aggravates things.
Yeah, and actually, one of the things that is in the sample deeming letter, even if I put up a link before, but even if you're not actually going to be asking for your deeming to be reversed, there is a link in there to some existing academic research that talks about the immune systems, how injured workers tend to present more compromised immune systems than other people because of the cascading health effects of work injury. So people can look to that for a link on more research. If you were an injured worker who was asking, for example, for a massage chair, to say, I can't go out, we don't know when I'll be able to go out by the very virtue of my injury, and the following reasons, I have a compromised immune systems, and it would be dangerous for me to go, and morally questionable for the WSIB to tell me to do that.
Mm-hmm. Yeah, I have a neck massager I recently purchased that actually really had been the closest thing I've found to feeling like hands-on massage. So
Right.
there's a lot more out there, and I think somebody, as was suggested, get in touch with your therapist, see what they can recommend that you try out, and try to get WSIB to cover it.
Yeah, absolutely. Awesome. Thank you, Catherine. Wonderful. So, done answering that question. There was one more question that we had in here, and that is a zinger from Richard. If they deny the $300 court request, can it be appealed? Who wants to go?
It should be appealed.
Yes. I think it certainly can be appealed if they deny it. The danger would be what Andrew Beaumais was talking about, where they refuse to make a decision on it. And this is something that happens around healthcare stuff a fair bit, particularly like denied medications. Injured workers just show up to the pharmacy and their medication isn't covered. There's no denial letter. It becomes very hard to appeal. So I would say just really press your case manager to make a decision on it, and on that, to deny it so that it can be appealed. Call us. We'll certainly help facilitate the process of appealing in terms of the mechanics of appealing. And if your case manager won't do it, then you can try calling the main number and asking to speak to your case manager's manager. And of course, if they won't do it, you can always try calling our friends at the Fair Practices Commission and tell them that the WSIB won't give you an answer to a very reasonable question. Any additional thoughts on that one? Okay.
I guess the only thing I'll add is that, sorry.
No, you're here.
Yeah. Okay. So the only thing I wanted to add is just also responding to Andrew's comment about not seeing the section where like they might not make a decision, or they might say that there's no section that allows them to do this. And so I think in that case too, like call IWC and we'll kind of think through this some more, because I'm not as pessimistic as Andrew that there isn't any wiggle room in the legislation, especially if it's something like people needing cab fares to get to medical appointments or the pharmacy, because one of the things he listed was extraordinary transportation costs to obtain healthcare. So, I mean, maybe it's used in different ways, but I think that there is some wiggle room or modifications to a person's home. We can and assistive devices like the massage chairs and things. So it might be a harder sell on things like extra grocery costs, but I think that there's more flexibility, and also things can be done through kind of regulation and orders in council. Anyway, just to say.
And I think we would I would love the opportunity to make an argument that nutrition is that proper nutrition is a vital piece of healthcare, and it's certainly something that has been done in the past with the special diet stuff around OW and ODSP, where the Ontario's Chief Medical Officer of Health said that poor nutrition was a medical issue, and so it has been argued in the past that food is healthcare. So I mean, obviously that's not going to be a first round operations level decision, but that's why we're encouraging people to be asking for this stuff so that it can be denied, so that we can work together to help point out how absurd it is that the WSIB is fumbling the ball on COVID in a way that is really morally reprehensible. In a way that not even OW and ODSP and OAS, which are in no other ways can be constituted as generous programs, but that they're way ahead of the game on this, and so we're just trying to kind of brainstorm ways that we can to come at this from a lot of different directions to ensure that WSIB fulfills their responsibility of looking after injured workers.
So I hope David's comments and we have made it really clear that we're not trying to say, oh, everybody should make this claim and you're going to get your $300 and this is part of the act. Like, I hope it's clear that we're suggesting that this is something injured workers do, as David said, to hold the WSIB to account, and we're going to try to advocate and push them. And we're not saying do this and this is a benefit you can get for sure. It's a let's fight for this situation. Yeah. So I hope that was clear, but just in case it wasn't crystal clear.
I think we told you we'd keep you for an hour. It's been about an hour and 15 minutes, but thank you so much. We'd love to hear from people if they have any feedback about this. And I think most people would have signed up to this because of an email that came, at least indirectly, from me. So I'm easy to track down. And if there is something that was just not working for you, or other topics that you would like, or guests you would like to see, or really we're open to a lot of ideas here. So track us down here. Maybe in terms of, I don't know, we didn't talk about this, but Orlando, would you be interested in offering some closing remarks to the fine listeners?
Sure. Other than the recipe, okay.
Well, I'll make a poster advertising the links for June 1st and the vigil while you're doing this. So go on for a couple minutes.
Okay. Well, it's been very interesting feedback we got. So thank you so much for the commentators and for the people that have sent all the comments. Well, I was struck by a number of things. I'm glad that Andrew raised the issue of the people who are quarantined, and how that constitutes a functional loss. So there's a lot of questions, like, is this part of the act, whether we're dealing with the quarantine people, as well as the $300, or I see that Catherine is suggesting $400. Is this part of the act, and what should we do? So my experience with the WSIB, and I've revealed today to the staff that I'm now reaching 100 years old. My experience with them is that they can do anything they want if they want to. They can. If they are embarrassed enough, they will do a lot of stuff. They don't have to be constrained, straitjacketed by a narrow interpretation of the act. So I think we should, and we need to get to the political leaders, because the WSIB doesn't think on its own. So if the political leadership, and I would have said that there's no way to talk to them, but now the times are different. There's a crisis, there's an emergency. So we need to embarrass the WSIB and the politicians behind it to say, you've come up with nothing. every level of government, every political leader is going out of their way to help injured workers, and there's nothing for the extra cost to the workers, and there's very little for COVID, and people quarantined are not paid at all. So they can do this. For example, I'm old enough to remember that people were quarantined in the past with respect to asbestosis. So it was a form of quarantine. So John Mansfield Plan in Scarborough. So I represented some of those workers, and the board said, we now understand that if you go back to the plant, you may get asbestosis, you may get mesothelioma. So in order to prevent you from getting sick, we will pay you. We will set up a special rehabilitation program, which means we'll send you to school, we'll teach you other things, but they're not going back to that exposure. So they had no symptoms, but they could have gotten symptoms. So it's the same thing as quarantine. They had a policy. It can be done again. And if they don't do it, then I suggest that we follow Andrew's, insight that, yeah, this is a functional loss. And we should do the same with appealing it. But we should embarrass them into doing something, because it's very embarrassing. And we have enough political clout to push them a little bit. So those would be my comments.
Amazing. Well, I think that then that brings us to the end of our time here. Thank you so much. Before we go, I'm just going to put up a poster. For the last 36 years, injured workers have gathered on June 1st as a celebration of the power of injured workers, as a celebration of the resilience of injured workers, as an act of resistance. Have gathered in Queen's Park. And for the last 15 years, the Women of Inspiration have sat vigil overnight. And of course, those things can't happen there this year. They won't be happening in person, but they are significant enough events that we decided that, we didn't decide, the Women of Inspiration decided, the Ontario Network of Injured Workers Groups decided that they would take place online. So they're going to take place right here on Crowdcast. They're going to take place right here on Crowdcast, and you can see now the links to those things. So I'm going to sign off. Catherine and Orlando, I've already booted them out, and I'm just going to leave this up a little bit there. You can watch on Crowdcast on YouTube. 4 p.m. on May 31st for the vigil, which is going to have songs and stories and messages of hope, and 11 a.m. the following day, where we're going to have messages from the Ontario Network of Injured Worker Groups, from the OFL, from a number of our partner unions, from a lot of injured workers, and we're going to have a group video. We've got people all over the province, and in fact internationally, participating and making a statement and a series of demands for the WSIB. So thank you so much for being here today. We look forward to doing one of these again, and I will talk to you soon. So be safe out there, please, and call us if you need anything.